What is axis deviation? Your heart pumps blood around your entire body coordinated by an incredible electrical system. A normal heartbeat begins when the ASA node fires electrical impulses. This makes your atria contract, forcing blood into ventricles. When the impulse reaches your AV node, it pauses before moving to the ventricles. This makes your ventricles contract, forcing blood out of your heart and around the body. This direction of electrical current, as a vector, is the normal axis of your heart. The range of the normal axis is between 0 to 90 degrees. And when the vector is between 0 to -90 degrees, it's called left axis deviation. And when the vector is between 90 to 180 degrees, it's called right axis deviation. The vector between -90 and 180 degrees is very rare, and it is called extreme right axis deviation. Let's learn this with ECG changes. The ECG leads in the direction of vector of electrical current has a positive QRS complex, and away from vector has a negative QRS complex. The most important lids in evaluating the axis are lid 1, lid of VF, and lid of VR. In the normal axis, lid 1 and lid of VF are in the same direction of vector, that's why they have positive deflection of QRS complex. And lid of VR is in the opposite direction of the vector, so it has a negative deflection of the QRS complex. In the right axis deviation, lid of VF is in the same direction as the vector, that's why it has a positive deflection of the QRS complex. While the lid 1 and lid of VR has a negative deflection because they are not in the same direction as the vector. Left axis deviation has a further two types. 0 to -30 degree axis deviation is called physiological left axis deviation, and -30 to -90 degree axis deviation is called pathological left axis deviation. In the left axis deviation, lid 1 is in the same direction as the vector, that's why it has a positive deflection of the QRS complex. While the lid of VF and lid of VR has a negative deflection because they are not in the same direction as the vector. In the extreme right axis deviation, lid of VR is in the same direction as the vector, that's why it has a positive deflection of the QRS complex. While the lid 1 and lid of VF has a negative deflection because they are not in the same direction as the vector. Let's look at this in 12-lid ECG. In this ECG, the lid 1 and lid of VF has a positive deflected QRS complex, and lid of VR has a negative deflected QRS complex. This is seen in normal axis ECG. Now look at the another ECG, and try to find the axis deviation by yourself. Yes, you are right. This is the ECG of right axis deviation. We can clearly see the positive deflected QRS in lid of VF and negative deflected QRS in lid 1. Let's check this one out. Right, this is the left axis deviation with positive deflected lid 1 and negative deflected lid of VF. Now look at this extreme right axis deviation, with both lid 1 and a VF are negatively deflected, and lid of VR is positively deflected. What are the causes of axis deviation? Older age, obesity, and mechanical shift in pregnancy are the causes of physiological left axis deviation, and it is considered normal. While emphysema, left ventricular hypertrophy, left anterior fascicular block, inferior wall myocardial infarction, left bundle branch block, and ventricular tachycardia are the causes of pathological left axis deviation. Emphysema, right ventricular hypertrophy, COPD, left posterior fascicular block, right bundle branch block, and ventricular tachycardia are the causes of right axis deviation. Thank you all for watching the video.